Notice how the time frame changes. 2 hours later. So 2 hours pass by. The patient's still in ICU. Okay? Unless they tell you that the patient is somewhere else, the patient is still in ICU. The last current place. So 2 hours later, the ICU nurse goes sees Mr. Smith and notice the following. Crackle audible through both lung fields. Uh-oh. Client is coughing up pink, frothy sputum. There is now jugular vein distension. Oof. We see a change, a drastic change in 2 hours here. The BP, 115/85, heart rate 108, not much change there. Peripheral pulse 2 out of 4, with a capillary refill time of less than 3 seconds. Oxygen saturation is 85, with the oxygen at 4 liters per nasal cannula, and now the respiratory rate went up, 38 breaths per minute. There is 3+, 4+ spinning edema in her feet and up to the mid-calf. So you see that the scenario progressed. The question is the patient better or is the patient worse? The patient is worse, right? But notice how this question now is not really a priority question. It's a understanding diagnosis question. Based on the history, the nurse will be most concerned about which complication. This is a very difficult content question. Why? Not only you need to know what this clinical scenario means, but you also need to know the clinical manifestation of pulmonary edema, cardiac tamponade, pneumonia, and pulmonary embolus in order to identify if this scenario is one of these. So, what is the answer, Professor? The answer is pulmonary edema. Answer number 1. I see some of you putting answer number 2, number 4, number 3. So why is not cardiac tamponade or tamponade, depending on how you pronounce it? Why not 2? Because in cardiac tamponade, we will see a high pulse and a very low BP. What do we have? Normal BP and a little bit tachycardia. Okay? And another thing that we will see weakened peripheral pulses. So we will not see peripheral pulse 2 out of 4. We will see weakened peripheral pulses. So cannot be cardiac tamponade. Okay? So why not pneumonia? Why is this scenario cannot be pneumonia? Because the trend and how the patient change looks more of a complication of heart failure than an infectious problem causing pneumonia. So 3 can be eliminated. It's not described as pneumonia. Why can it not be a pulmonary embolus? That is a good question there. Why not pulmonary emboli? What do you think? what is a pulmonary emboli? Or when does a pulmonary embolus occur? When a blood clot goes to the lungs. Where does the patient have, it says mitral regurgitation, mitral insufficiency. Remember the diagnosis at the beginning? So the problem is on the left side of the heart. So a blood clot on the left side of the heart will not cause a pulmonary emboli. If there is the development of a blood clot, it will go into the systemic circulation. So answer number 4 does not make sense. Final answer is 1.